Welcome everyone. So this is session two of our RaCEEs course, and thank you for attending this session today. Today we're going to talk about key attributes of an economic evaluation. So it's a slightly longer session this time because we need to cover quite a lot. There will be quite a few concepts we are going to go through, but don't worry too much about trying to remember everything. It's just a very extensive coverage of the main thing you need to know about economic evaluations, how to read them, and how to understand key concepts about them. Today I'm co-running this session with Luis. You met Luis during session one, and I will cover the first part of the session, and then Luis will take over, and we'll talk about specifically modeling in the second part of today's session. Before I start, do you have any questions on the homework post session one? Uh, if you got any burning questions you want to ask about any, I don't know, problems you had for choosing an economic evaluation. Okay. So first of all, I want to thank everyone for doing the homework. It was really good to see so many people doing the homework and also so many good papers. And we were talking a few minutes ago about how challenging it was to choose an economic evaluation for each team. So it was a tough choice I guess for everyone, to be honest, for every team. I'm going to give you an overview of the decisions we made so far. So in terms of the different teams, we have a definite decision for the nutrition team, which is led by Kath. So Kath team will work on this economic evaluation, which is cost effectiveness of improved women, infants, and children food package for preventing childhood obesity. I made a decision for the dementia theme, so we're going to look at the economic evaluation, which is called the cost effectiveness of an intervention to preserve independence in people with dementia versus no intervention, a decision analytic Markov model analysis. And I think Andy is very close to a decision also for the digital health team, and the same for Luis and Ryan for the frailty team. And I think Misael is in the process of choosing the economic evaluation for the cancer care team. So I hope between today and tomorrow we will all have like an economic evaluation paper which you're going to work on throughout the course. And of course, the PDFs are already on the Teamspace, or they will be on the Teamspace in the next few days. Okay, so session two is about the key attributes of an economic evaluation, and I'm going to show you now the sections of our final commentary. So when we will do the workshop in September, we will start writing up our commentary, and the commentary at least on paper, we'll have different sections. We will probably make some adjustments depending on the journal requirements, but on paper at least, we will start with these sections. So the introduction, the methods, the results, and the actual commentary bit, which we will use to critically appraise the economic evaluation paper. The introduction is the first section, but is actually the last section we're going to try to write up. So we will use the information that you will actually extract from the paper after session six. So for now, let's not worry too much about the introduction. I'm going to give you more information at session six. But the introduction of the commentary will focus on why the economic evaluation is important and how it adds additional knowledge. Then the commentary paper will have a method section which will summarize the main feature, the main characteristics of the economic evaluation paper, which you're going to work on. Particularly, we're going to summarize the key attributes of an economic evaluation, the cost data, and the outcome data. So each section, now section two, three, and four, we will cover all these different characteristics. And after each section now, you will have an homework which will consist of extracting information from the paper. So after today's session, you will be asked to extract the information about the key attributes. After session 3, you will be asked to extract information about the cost data. And similarly, after session 4, you'll be asked to extract information about the outcome data. And all that extraction work will be used to write up the method section of our final commentary. Then after session 5, we will again do a bit of an exercise around the results, how to interpret the results, and we will work on writing up the main analysis and the sensitivity analysis, a summary of those analysis for our commentary. And then at the workshop, we will focus more on a critical appraisal, implication for policy and practice, recommendation for future research. So in a way, for the introduction, method, and the result, we are objectively describing the paper in a way, summarizing the main characteristics and so on. And then in the commentary, we put our own thoughts, our own view, and also our own expertise in a way, in order to critically appraise the paper and also try to formulate some implication for policy practice. But we will, of course, go through all these a bit more in depth at the workshop. So for today and for the next couple of sessions, we will focus on the method of the economic evaluation. Any questions so far? Okay. So overview session 2, we are going to try to understand and describe the key attributes of the economic evaluation. I'm going to talk about the interventions being compared, including the population and the location and setting. And then I'll cover very quickly some concepts like the type of economic evaluation used in the study, the sample size, the perspective, and the time horizon. And then Luis will talk a bit more about the modeling techniques. For each of these concepts, we are going to give you the definition, first of all, and then we're going to show you how to locate this information within the papers. And then we're going to also show you an example from a previous RaCEE, how we extracted the information and how we wrote up that information in a very condensed and concise way, okay? So we start with the first concept, which is the interventions being compared. Now, I think the economic evaluations you're going to work on will all focus on, say, virtually all focus on a randomized trial or on a simple comparison, let's say, between interventions. So any economic evaluation will compare two or more interventions. Typically, we got a new intervention like a drug therapy, a type of surgery, and that will be compared against usual care or standard of care. There might be more than two interventions be compared. We had papers in the past where we had three interventions, so it could be that your paper will focus on a comparison between two or more interventions. Now, in terms of how to extract the information around the interventions, that will usually be located within the method section of the economic evaluation paper. So any paper will probably have this typical structure with an introduction, method, results, and discussion and conclusions. And in the method section of the economic evaluation paper, you can find some information about the intervention. In particular, you can find information about the population. So that would be the characteristics of the people and the patient targeted by the intervention. So it could be people with diabetes, people who survived a stroke, and so on. And then you will also try to find, or you should be able to find the type of interventions being compared. So whether it's a pharmacological intervention or psychological or a combination of both and so on. Within the method, again, we should find some information about how the interventions work. So if it's a drug, administration, frequency, dosage, a therapy, the number and type of frequency of sessions, who delivers the session, who receives them, and so on. If it's a diagnostic tool, we will probably try to find some information on the characteristics of the scans and the tests and so on. So all of this information regarding the interventions ideally or typically is located within the method section. There might be some exceptions in some cases, of course, but typically we'll find all this information in the method section. Similarly, for the location and setting, again, the intervention might be located in the UK or in other countries, or you might have also some indication of where the intervention was run from a regional point of view, or even some indication about the cities. And also the settings, primary, secondary, or tertiary, or other settings where the interventions took place. So I'm going to give an example now in order for you to understand a bit more how to extract the characteristics of an intervention from a paper, because this will be part of the homework after today's session. So the population receiving the intervention should be clearly outlined within the aim of the study, typically one of the last paragraphs of the introduction. The type of intervention, so how they work, should be typically in the methods. Location and setting, again, should be described, maybe in the aim, also typically in the method. So I would suggest looking at the last paragraph in the introduction, but also in the method, you'll get more detail about all these different concepts. And this is an example from an article we assessed in the past, where we got some information about the population here in green. That was actually at the bottom of the introduction. And then some information about the type of interventions in yellow or orange here. So you got this intervention, which was a particular intestinal gel for people with advanced Parkinson disease. The comparator was standard of care in this case, but if you go into the methods, you get some more information about the intestinal gel and also how it was administered. So you get more details in the methods. So in my opinion, at least, it is always good to look at the introduction, but you get probably more details about the interventions within the methods section of the paper. And the location, of course, here in purple or pink, actually, sorry, which is England. And this is how we extracted all this information, and now actually we wrote up the characteristics of interventions in our paper. So all that information from the actual paper was condensed in a few sentences in our commentary, which you can see here. I'm not going to read it all, but you got access to that commentary paper in your folder. So if you go on your TeamSpace, there is a folder called example previous RaCEEs, and you can have a look at that RaCEE in particular, and you can have a look how we wrote up that the method of the paper, but also the results and so on. Any questions so far? Okay. So here, okay, we got another classification where the different information regarding the key concepts are, so the type of interventions, population, and location. Now, I'll move on to the analytical approach, which is going to be the main bit of today's session. So we're going to cover a few concepts regarding the method behind the analysis of an economic evaluation. I'm going to talk about different types of economic evaluation which could be used in the study you're going to work on. And then I'm going to cover sample, perspective, and time horizon, which are again key concepts which are very peculiar to economic evaluation analysis. And then, as I mentioned before, Luis will talk more about modeling techniques. So, types of economic evaluation. This is quite a big table with a lot of information, and I'm going to try to go through each economic evaluation one by one, but I'll try to focus more on the two main types of economic evaluation. So, starting from probably the simplest approach or the simplest type of economic evaluation is cost minimization analysis. And you can see here that we got a measurement or valuation of costs with respect to the interventions being assessed. So as mentioned before, you can have two or more interventions which are being compared. And the measurement evaluation of cost, as expected, probably will be done in monetary units. But in a cost minimization analysis, there's no real assessment, let's say, of the outcomes of the interventions. Why? Because there is an assumption that the two intervention will produce a similar level of outcomes. So the whole focus of the analysis is actually on the cost, whether one intervention could be actually be cost saving compared with the other. You got an example here where you got a comparison of the cost of administering a therapy to treat hypertension using two alternative modes of delivery, which are considered equally effective. And the two alternative modes of delivery are in the hospital outpatient setting, or in private homes by involving community health staff. So the whole focus, as I mentioned before, is just on how much these two alternative modes of delivery might cost. So this is a very hypothetical example. Uh, and if we were to run this analysis, as I said, we will just focus on cost, but there is a very strong assumption that the outcomes will be similar. And this, of course, might not be true and might not be realistic. So in reality, cost minimization analysis is not so widely used because, of course, there are some limitations which might affect the assumptions being made around the outcomes of the interventions. Cost consequence analysis, instead, we have a focus on the outcomes as well. So besides the consideration of the cost, again, monetary units, we also look at the outcomes. We also look at the consequences. And we look at these outcomes in natural or monetary units. So there might be some outcomes that we can quantify from a monetary point of view, but typically most outcomes are measured in natural units. So, for example, you got some example here. Acceptability, again, there could be, I don't know, a questionnaire which measure the level of acceptability. Willingness to use, similarly, there might be some kind of instruments which we can use to measure the willingness to use a particular treatment or a particular intervention in general. Resource use, health outcomes, all of these will typically measure in natural units, or there might be also some outcomes which might be possible to measure in monetary units. But all these outcomes, and this is important to note, will be listed separately, one by one. There's no aggregation. Everything is a bit disaggregated. With a cost effectiveness analysis, again, comparison of cost and outcomes together, but this time we focus on one single effect of interest. So rather than having multiple effects of interest, here we have a single effect of interest, which could be the primary outcome measure of a clinical trial, for example. Here in the example, you got a comparison between two alternatives in terms of cost and a primary outcome, a single effect of interest, which is measured by reduction in blood pressure. So if you got a clinical trial focusing on hypertensive people, as expected, the primary outcome might be a reduction in blood pressure, and that will be also the primary outcome of the economic evaluation. These types of outcomes will be measured in natural units. So again, you got some other examples here, like life years gained, disability days saved, and so on. But it's important again to note here that we move from multiple effects to a single effect of interest. So there is a very strong focus on one particular outcome that is going to be particularly relevant for the condition we are looking at or for the disease area we are looking at. Cost utility analysis. Cost utility analysis, again, comparison of cost and outcomes together. So we got a joint analysis of cost and outcomes. But in terms of the outcomes, we are looking at specifically at a composite outcome in a way which takes into account quality and quantity of life together. So that is in a way, multiple effects combined into one outcome, into one single outcome, because we are talking about healthy years. So not only how long we might live as a result of receiving an intervention, but also how well we are going to live as a result of receiving this intervention. And this concept of healthy years is measured or operationalized by looking at quality adjusted life years, so, or QALYs, which I'm sure some of you will have heard of before. I know that some of the papers you're going to look at will, of course, look at QALYs, and we will discuss QALYs a bit more in session 4 when we cover the outcomes. But for now, it's important to notice that we are looking at a single composite outcome, which is a bit different from looking at a single effect of interest measuring natural units. Here we are looking at single composite outcome because we are trying to combine quality and quantity of life together. So quality of life changes and life expectancy. These two types of economic evaluation are the most common, cost effectiveness analysis and cost utility analysis. And cost utility analysis is actually a special subtype of a cost effectiveness analysis. And it's important also to know that these are not mutually exclusive. So you could have an economic evaluation with a cost consequence analysis as well as a cost effectiveness analysis, as well as a cost utility analysis. So you could have different types of economic evaluations being run as part of just one study. And the last type of economic evaluation is a cost-benefit analysis, which again, we got consideration of cost and outcomes together, but everything is measured in monetary units. So for example, looking at the comparison of alternatives A and B, both costs and consequences are measured in monetary terms. For example, by estimating how much the treated patient will be willing to pay for the therapy. So there might be some questionnaires which are administered where we're trying to understand how much people are willing to pay for a specific treatment or therapy and so on. So we're trying to monetize the outcome in a way. Now, not always will be possible to do so, and there are some things which are quite intangible, so it will be difficult to monetize them. And this is one of the reasons cost-benefit analysis is not widely used as cost effectiveness analysis and cost utility analysis. But you might still find quite a few papers which will use cost-benefit analysis. Any questions? Okay. So another example how to extract the analytical approach from analytical approach info, from a paper. The first thing I will say is that it's important that you do not jump to conclusions. Now, we saw the titles of the papers before. The term cost effectiveness was in the title already, and you will find a lot of titles of economic evaluation which include the term cost effectiveness, but that does not necessarily mean that the authors conducted a cost effectiveness analysis. Okay. Cost effectiveness is often used as an umbrella term, which means value for money in just plain terms, and is often abused as a term. So do not jump to conclusions. If you see that in the title, doesn't mean the people that run the analysis actually did a cost effectiveness analysis. It's important to go inside the paper and looking at the outcome measure used by the authors in the methods. So for example, if they use the cost per 1 point reduction in blood pressure. Now, blood pressure is an outcome which is measured in natural units. It's a specific clinical outcome, so it's likely that they have run a cost effectiveness analysis. But instead, if they looked at the cost per additional health years, typically measured by the QALYs, then the authors will have done a cost utility analysis in that case. In the article I showed you before, so this article on advanced Parkinson's disease, the authors looked at life years and quality adjusted life years together. As I said, the types of economic evaluation are not mutually exclusive, so you can have more than one type of economic evaluations being run as part of one study. In terms of the concept of sample perspective in time, we got a question, I think. Okay, Nicola,
Good.
that's fine. That's fine. Thank you. In terms of the other concept regarding the analytical approach, I'm going to cover very quickly sample perspective and time horizon. So these are, I think, concepts which are to some extent peculiar to economic evaluation. Of course, sample is a very general term which can be applied to other studies, but perspective and time horizon are probably a bit more peculiar to economic evaluations. You can find all this information again, typically in the method section, and we will include all this information in our method section. So the sample will be the type of participants involved and the size of the sample. This differs a bit from the population. So with the population, we're trying to describe generically the people we will be on which the focus of the study will be. So stroke patient, like I say, people with cancer and so on. The sample we describe a bit more the type of a participant involved. So there might be some inclusion, exclusion criteria, which the author used to select a specific sample, a specific set of patients that were involved as part of the study. And we should also capture the size of the sample. The perspective will consist of or will be related actually to the range of costs and outcomes considered. So if the costs are those which are attributable to the health and social care system only, for example, or they might be attributable to the society, to the whole society more widely. And we will cover this concept of perspective a bit more in section 3. Similarly, the perspective will change according to whose outcomes you are considering. So it might be the outcomes of the patients, but also the caregivers and so on. So there might be a narrow or a wider perspective being taken into account. Time horizon is simply the time scale of the analysis, which might be short term. So it might be an analysis which was run as part of the study period of a randomized control trial, or longer term. And Luis will describe this a bit later on when we're going to look at modeling techniques, which enables us to extrapolate the analysis or extend the analysis into possibly the lifetime of individuals. How do we extract all this information? Again, typically will be in the methods of your economic evaluation, but the information about the sample size could also be in the results section as well. The perspective will be in the methods, could be also within the aim of the study in the introduction, and typically the time horizon will be in the methods. If you struggle, I will just do a Control F. Okay, I know it sounds like a very unorthodox tip, but yeah, usually if you do Control F and you put perspective in virtually all cases, you should be able to find the perspective quite quickly, and so you can have a look and try to extract the information from the paper. We're going back to the article on advanced Parkinson's disease, and I'm going to show you the information we managed to extract from that paper in terms of the perspective, the sample, and the time horizon. So here you got the information about the perspective, which was actually at the bottom of the introduction. And then the information about the sample here in pink. So as you can see, the information we extracted is a bit more specific compared with the population. So we are looking at patients with advanced Parkinson's disease and severe motor fluctuation defined on the Hoehn-Yahr scale, and then some more information there. But you can see how everything is a bit more specific. So it's not simply patient with advanced Parkinson's disease, but they have to have specific characteristics. And the sample size is here as well. In terms of the time horizon, it's simply 20 years in this case. So you got just a sentence describing that. And similarly to what I was showing you before, we then wrote everything up in our method section of the commentary. So we used a couple of paragraphs to describe the type of economic evaluation, the sample, and the time horizon. Okay. Any questions before we move to Luis' part? Okay, Luis, I'll stop sharing. You can start sharing your stance.
Oh, I didn't unmute, sorry. I clicked to unmute. Is it sharing?
Yeah, you just need to put, that's fine.
No, I unmuted, but apparently I didn't. Okay. Hi all. So this part is going to be about basically the models that you are going to see in economic evaluations. So again, Valerio already told you that you are not supposed to learn sometimes how everything works. It's more for you to know what things are out there, so that when you are reading the paper, you are able to identify them and to understand the minimum, more or less, how they work. Again, this is very complex. Just for you to have an idea, I teach economic evaluations, and just in decision trees and Markov models alone, it will, like, I gave 6 hours of teaching plus homeworks, and students had to go and do a lot of self-study. So don't feel like you need to understand it all. It's just for you to have an idea of what you are going to find in the papers that you are evaluating. So first, what are models? Why do we need the models? So the models are basically, as the name implies, models. It's a way for us to create a structure and systematize the economic evaluation that we are going to do. And they are very helpful because they help us, for example, to extrapolate beyond the clinical trial, beyond observable data. They will help us link intermediate clinical endpoints to final outcomes. They will help us generalizing the economic evaluation to other settings, because a lot of the times you are doing things in, for instance, a trial, but then you need to understand how it would work if generalizable to other settings, and it can help with that. It can help to do some analysis even in the absence of some very hard data. But, well, you don't need to understand this necessarily in a short sentence. What you need to understand is that the models will allow us to create more complex designs.
Sorry, Luis, sorry.
Yes.
We can hear some beep. I don't know if I think Kirsty can hear some beeping as well. Is there some beeping going on or
No.
no? Okay.
Is it from me?
I think it's gone.
Okay.
Or maybe.
But I was just saying that in a short sentence, the models will basically allow us to provide some more complexity to the economic evaluation, which will help us better characterize let's say, the disease, the condition, the treatment, etc. So you will find, I would say, 4 types of models. You'll find decision trees, which are to some extent the most basic ones, and they are usually used when the problem is relatively short term. So almost within the context of a trial, if it is not more than 1 or 2 years, you probably use a decision tree. Then you will have the Markov models, which are an extension of the decision trees, and they are usually used when you need to follow the patients through time. For instance, if you believe that the condition develops through times where the patients move from state to state, I would say mostly for chronic diseases, basically diseases where there is a disease progression that you need to account for and that you need to model. But then Markov models have a problem, which is called the lack of memory. They don't look at each individual specific. You are going to see in very, very shortly, but they look at cohorts. So they don't have memory. So if a person in the cohort went through some situation, has a certain history of disease, and you need to account for the history of disease. Usually Markov models are not very good at doing that. So you may want to go for for simulation, in visual simulation types of models, where you have micro simulations and discrete event simulations. So they are very similar in the sense that they look at, let's say, one person specifically, and they follow their trajectory. But micro simulations usually only look at the individual and their progression. Discrete event simulations usually also look at resources and possible bottlenecks. And that's basically the main difference between the two of them. Now, you probably didn't understand anything of what I just said, but let's look at the models so that you have a visual aid and you can understand what they look like. So let's start with the decision tree. So I'm using the most simple decision tree you will ever see. But I think it's good to start with a very simple thing. Otherwise, you would give up right now. We don't have the time also, so let's start with a very simple one. So in this decision tree, you can see that we have treatment X and treatment Y. And the first thing that we need to do in the model is decide which treatment we are going to use. So you have this blue square here, which is basically called a decision node, telling us, do we go with treatment X or with treatment Y? Then, if we decide to go with treatment X, we can, with some probability, have the patient cured, or with some probability the treatment is not going to work and the patient is not cured. So the same with treatment Y, with some probability the patient is cured, with some probability it doesn't work. And this is called the probability nodes. And then at the end, you have the outcomes, or the payoffs, they sometimes call them. And in this case, in the payoffs, what you are going to have is basically the conclusion, what happens, what are the outcomes for the patient. And in this case, in this example, we have life years here. So life years, if the patient is cured, in this case, I'm looking at treatment X, and the costs. So the costs are going to be this first part, which is the cost of the treatment, and the second part, which is basically a yearly cost of staying alive. So if the patient stays alive, then they cost the healthcare system a certain amount because they still need to go to the hospital. And this yearly cost is going to be multiplied by the amount of time that they live. So please tell me if you have any question. Feel free to interrupt and just talk, but this is the idea. And the same is going to happen in the no cure. So if the patient is not cured, then the life expectancy of no cure should be lower. And then the cost, we still have to pay for the cost of the treatment. It's just that the treatment didn't work. And then for the yearly cost of staying alive, again, multiplying by a life expectancy, that is lower because the patient was not cured. And it's exactly the same for treatment Y. So I'm not going to repeat myself. Let's just give it some numbers for you to see, and let's try to solve a decision tree. Now, this is just exactly the same figure. It's just that now we have some numbers. So we can see that treatment X has a probability of cure of 75% and has a probability of no cure of 25%. So if a cure occurs, the person is going to live another 30 years, okay? If a cure does not occur, the person is going to live only 20 years. Now, treatment X has a cost of £10,000, so is this first part here, which is going to be paid with cure or no cure, because we did the treatment. Now, if the person, let's say, if in this upper part, if the person is cured, then the person is going to live the 30 years. So 30 years times an annual cost of 1,000. So this is in dollars. So let's say $1,000, and it's going to give a total cost of 40,000. Okay. In the no cure, because the person is going to live for only 20 years, the annual cost is going to be the same, 1,000. So if we sum this, we get 30,000 as the final cost. Now, let's look at treatment Y. Treatment Y seems to be a lot better than treatment X. So instead of a 75% probability of cure, it displays a 90% probability of cure. So it is a lot better than treatment X. So again, in terms of what they live is the same. If they get cured, they live 30 years. If they don't, they live 20 years. But the costs, you will see that the costs of treatment Y are huge. So it's 100,000 instead of the 10,000 that we saw in treatment X. So 100,000, and then the same thing as we saw in the other ones. If because the person is living for 30 years, you multiply it by the annual cost of 1,000, and you get $130,000 for this arm where the person is cured. If the person is not cured, so you still pay the 100,000, but then it's 20 times 1,000, and you get the 120,000 pounds. Okay, so we have all the information that we need to solve this decision tree. So let's solve the decision tree. Just tell me, please, if you have any question. Please just interrupt me and make the question. Now, let's try to solve this then. Let's start. Basically, we need to do this arm by arm. It's the easiest way to do it. So let's start trying to find the expected costs of treatment X. Then let's do the expected costs of treatment Y, then the expected benefits of treatment X, and the expected benefits of treatment Y. So let's start with the first one. What are the expected costs of treatment X? So let's see. The costs, if there is a cure, are 40,000, not pounds. So here is dollars, sorry. And then if no cure occurs, it's 30,000. However, there is a probability of a cure occurring or not, so the expected cost will depend on that probability. So what are we going to do? So with 75%, we need to pay these 40,000 pounds. So that's what we are going to do here. With 75%, we pay the 40,000 pounds, this first part. But with 25%, we pay the 30,000 pounds. So we need to do this sum. So 75 times the 40 and 25 times the 30. And we get to a total expected cost of 37,500 pounds. Then in the expected cost of treatment Y, we do exactly the same. It's just that the probabilities are going to change and the costs are also going to change. So in this case, if the person is cured, it's 130 times 90%. And if the person is not cured, it's 120 times 10%. So it's exactly what we have in here, and we get these 129,000 pounds. Okay, so we have the costs, and we can see right away that the expected cost of treatment X is a lot lower than the expected cost of treatment Y. However, we saw that treatment Y is this new shiny technology that is very expensive, that works really well. So let's look at the expected benefits. And we do exactly the same as the costs. It's just that instead of using the costs, we are using the life years. So let's go here in the beginning, treatment X. So we get with 75%, 30 more years, and with 25%, 20 more years. So this gives an expected benefit of 27.5 more years of life expectancy. Now, if we go to treatment Y, we have that with 90%, the person is going to live 30 more years, and with 10%, the person is going to live 20 more years. So 90 times 30 plus 10 times 20, this gives a total of 29 years of expected life expectancy. Sorry. Then we didn't see this yet. This is going to be in 2 sessions, if I'm not mistaken, but I'm going to do it anyway, which is I'm going to compute the incremental cost effectiveness ratio, which is the difference of the costs of both treatments divided by the difference in the benefits of both treatments. So let's pick our new shiny treatment Y, and let's do the cost of treatment Y minus the cost of treatment X, and divide by the benefits of treatment Y minus the benefits of treatment X. So we basically have how much more do we need to pay for treatment Y compared to treatment X, but how much more do we get in terms of benefits from treatment Y compared to treatment X. And this division basically gives the cost per life year gained. So in this case, if you do the math, it is going to be 61,000 per life year gained. So this, we are basically seeing the value of increasing one life year is going to be the 61,000. So if you are a decision maker and you believe that this is a fair number, you are like, okay, I'm willing to pay 61,000 in order for a person to gain 1 life year, then you should approve this technology, this new treatment. Why? If you think it's too much for 1 life year, you probably don't approve this treatment. Why? And this is an example, a very, very simple example of an economic evaluation. So questions, because this is going to be fast. I'm going to move to Markov models. So if you have questions on decision trees, now it's the time to ask. If there's no question, let me just say that they can be a lot more complex. This is extremely simplistic. So you could have things like in treatment X, for example, you could have the probability of people adhering or not. Do they adhere? Do they not adhere? And then if they adhere, you could have, again, the cure or no cure, but you could also have, for instance, adverse effects. And you would have to account how things would work in terms of costs and life expectancy with adverse effects. So you can make this a lot more complex. And in fact, if you have a decision tree in one of the papers that you are analyzing for these RaCEEs, it is probably going to be a lot more complex than this. But this gives you an idea. If when you are looking at the decision tree for your paper, if you are struggling a little bit, just feel free to talk to us, and we can help you try to understand the decision tree. We can also provide you some resources if needed. So yeah, just feel free to come to us. Now, no questions? If there are no questions, we are just going to continue very fast to Markov models. So what is a Markov model? A Markov model, in essence, is a repeated decision tree. Again, I told you that you use a decision tree if you want to look at only a very short period of time. But let's imagine that you have a disease with a certain progression that you want to follow what happens in 10 years, in 15 years, 20 years, then you are going to need a Markov model. And I'm, again, going to give you the simplest example that I can find, which is this one where the person can be either symptomatic, can be in a progressive state, or can be dead. Okay. Markov model is actually characterized by having some states and by people progressing within the states. So in here you have state A, B, and C, let's say, where symptomatic is the first state, and you can see this error, you can either stay in a symptomatic or you can move on to the other states. So you can, for instance, die from all-cause mortality, or you can enter the progressive state of the disease. Okay. Then if you are in the progressive state of the disease, you can continue staying in the progressive state of the disease, or you can die either by all-cause mortality or because of the disease. Then if you are dead, you cannot move, you just stay dead. So this is a very simple example of a Markov model, and you can see below a table that would give you the probability of moving between these states. So in this example, there is a probability of 66%, more or less 66.6 or 0.7% of staying in the asymptomatic state. There is 16.6% probability of going from asymptomatic to the progressive state. And there is also a 16.6% probability of going from asymptomatic to a dead state. Then if you are in progressive already, you have a 66.6% of staying in the progressive state and a 33.3% of going from progressive to a dead state. And of course, in the dead state, people have a 100% probability of staying dead unless they are Jesus Christ or something like that. So let's see how this works in terms of the model. So this is what we call a cohort model. We don't look at any person individually. We just look at a certain cohort. So if you start, everyone is in the asymptomatic state. So you can see the figures here. No one, this is empty. The progressive and the dead state are completely empty. And when time passes, so let's say an year passes, you will apply these probabilities. You know that 66% of these people here are going to stay in the asymptomatic state. And you know that 16% of the people are going to go into the progressive state. And you know that 16% again of the people are going to go into the death state. So that is what you would see from cycle 0 to cycle 1. You would see precisely that. And then things continue. In cycle 2, you see how many people are in the asymptomatic state. You apply again the probability of 66.6. And you know how many are going to stay in the asymptomatic state in cycle 2. And the same for progressive and the same for death. You just apply the probabilities. And at some point, let's say, for instance, in this cycle 8, you have this amount of people in the asymptomatic, this amount of people in the progressive, and this amount of people in the dead state. And this is going to go on like this for several cycles. And then less and less people will be in the asymptomatic state. Probably less and less people will be in the progressive state as well, and more people will be in the dead state as time moves on. Any questions so far? So I'm just going to give you a more complex example in the Markov model. This is a paper from Chancellor, an old paper from 1997. This is actually an HIV type of paper, where in state A, people are in a low severity state. State B, they are in a higher severity state. State C, they have HIV, so it's the worst state. And then in state D, they are dead. And this is just to show you in the table how this is going to work. It's very similar to this figure. So it's what I told you. Everyone starts in year 0 in the best state possible. Well, you can have different starts, but in this example, just to make it simple, everyone is going to start here, and then you apply probabilities. I'm not giving you the probabilities this time, it's just illustrative, but you will have people going from this less severe, staying in the less severe, or going to the more severe, or getting officially how do I say, diagnosed with HIV, or then going to death. Okay, and then you just continue. So you have the people, less and less people. If you see in the table, less and less people as time move on, staying in the best, the least severe state. Then you have initially more people growing in the more severe state, but then eventually decreasing as well, because people are moving until they go to the absorbing state, which is death. So you have initially also more people increasing in the HIV state, but then at some point decreasing because people start dying. And of course, you see that dying is always increasing. Now, I wanted to show you this table for you to see that if we are looking, for instance, to compute the number of life years, we can compute them directly in each cycle. Because, for instance, in state A, everyone in state 0, in cycle 0, sorry, everyone is alive. Okay. Then in cycle 1, you have that in state A, B, and C, these people are alive. So only 1% of the people are dead. So we know that 99% of the people are alive. So we can compute the life years based on this. Then, as you move on, the same you can check how many people are alive by summing the people that are in A, B, and C, and you know how many people are dead by looking at D. So you can compute the life years. Now, the way it works for costs is that typically you need to know what is the cost of staying in state A, what is the cost of staying in state B, and what is the cost of staying in state C. Usually D should have no cost. People are just dead, there's no cost. And then, because you know the number of people that are in state A, state B, and state C, you know the number of people that are producing the costs in state A, in state B, and state C, and you can compute the costs. At the end, if you sum all the life years across the cycles, and if you sum all the costs across the cycles, you have the entirety of the life years associated to a certain treatment and the entirety of the costs associated to a certain treatment. This is how a Markov model works. Now, questions? So if there are no questions, I'm just going to show you an example, using again the example that Valerio was using of RaCEEs that we've done on this Chowdhury paper, where they look at, they use a Markov model for Parkinson's disease. And it's a lot harder, a lot more complex than the ones I've been showing you. But you can see that in this case, people can progress on two levels. They can progress on the HY index, and they can progress in terms of the off time that they have. So for instance, they can have HY index of 1, and they can have 5 levels of off time. So 0, 1, 2, 3, and 4.
Sorry, Luis, we got a question from, I think, Lula.
Yes.
Lula, you were asking about the probabilities of movement between states for the previous example.
Hi,
So is it-
sorry. Just in general,
Okay.
what are the probabilities derived from? So how do we know, how do we calculate, or are these kind of, yeah, where do they come from, basically? Do not overcomplicate it. Let's just ask it. And
Yeah.
let's
So
simplify
they
it.
usually would come from other research. So they usually would come from clinical trials, from systematic reviews, which are probably based on clinical trials again. It can be from secondary data, where you can compute. You can see, for instance, in this example, people that are that have Parkinson's disease. If you have secondary data showing how people progress with the Parkinson's disease, you could use that to know the status quo. Probably you then need to know, you'd have a clinical trial in order to infer how a new technology, a new drug, for example, would affect those transition probabilities. But yeah, data, clinical trials, systematic reviews, which are going to summarize the clinical trials. I think that's it. Do you have anything to add, Valerio?
No, I think you're right. And for example, we do run a lot of economic equations alongside clinical trials. So we have the possibility of understanding within the time frame of the clinical trials the probabilities. So we use our own data to do that. And then going into lifetime, yeah, we use secondary data, like Luis was saying, or data from other literature. So, and of course, there might be some assumptions related
Yeah.
to that, but we'll have to handle that kind of uncertainty regarding assumptions. Yeah.
Yes, because this is very important what Valeria just said, because sometimes you don't know how things are. So, for instance, you know that a certain treatment is going to work very well within 2-period time frame, but you don't know if the treatment is going to continue to work well in 10 years. So sometimes assumptions need to be made. So in a model, you can, for instance, decide, okay, I'm going to assume that the effectiveness of the treatment is going to go down at a certain rate. You can do several scenarios. You can even say, no, I'm going to assume that the effectiveness of it stays the same. And then you probably provide the policymakers with several scenarios where you assume different things, and then the policymaker decides based on the different scenarios that you have. Any other questions? So if not, let me just conclude this figure. It's just for you to see that in this case they can move in terms of off time, but they can also move in terms of the HY index, which is basically the severity of the disease in terms of progression. And yeah, you can move from horizontally, you can move vertically, you can technically even move diagonally if the two of them are getting worse at the same time. So the HY index and the off time. You will see that there is a part highlighted here is just saying that in the paper, they are only looking at people that are in these levels of severity and off time, but that's just it. But you can see how much more complex this can be, because you have basically a five by five matrix. So you have a lot more states. In the previous one, we only had 4 states. In here, you have all this big amount of states. So, okay, this is a Markov model. Very, very quickly, I'm just going to give you an example of a discrete event simulation. I'm not going to show you a micro simulation model, but it's similar. It's just that in the discrete event simulation, people care about potential bottlenecks and resource allocation, but the idea is simple. So in this case, this is another example from another paper for angioplasty for infrainguinal arterial disease. So you probably know this a lot better than me, most of you, but it's just you have the arteries getting clogged, and you basically need to make the blood work, go through the arteries. This is lower limb, it's the legs. But yes, and you have this potential use of this percutaneous transluminal angioplasty, or another intervention that you may want to be comparing with. And people will enter the model, and then they can have the PTA, this percutaneous transluminal angioplasty, or another intervention. And then they go into the 30 days outcome, which can be, well, general mortality or procedure-related mortality, or they can be acute. They can have an acute failure, or they can be alive and patent. So then you can see that this story is already a lot more complex than in a Markov model. So if you have an acute failure, then people can go on to loss of patency, which can be to develop collateral symptoms, or and then go to mortality, or disease progression and then go to mortality, or in both of them they can go into a reintervention. Then in the reintervention, it may be again another PTA or bypass surgery, but it can also be amputation, which can lead to general mortality, which can lead to also to procedure-related mortality. So you see, it's a lot more complex. If we go to the alive and patent, again, there can be a late failure, that can be a development of contralateral symptoms, which can lead to general mortality. May also be a need for amputation, which again leads us to this part. So you can see that it is a lot more complex, and usually these are used if you need to understand the story of the patient, these more complex possible progression where the story counts. So you need to look at each one individually, because then the transitional probabilities are going to depend on the story already of the patient within this pathway. Now, you can technically usually do Markov models as well for more complicated stuff. It's just that computationally it becomes very difficult to use the Markov models, so people at some point tend to go with the discrete event simulations or the micro simulation models. Also, if, for instance, let's say here in this amputate, imagine that people need to enter a queue. If there are bottlenecks, resource allocation problems, imagine that reintervention as well, people need to enter some sort of queue for the reintervention, then you may want to go with the discrete event simulation. So again, you may find some of these in your paper that you are going to be analyzing. I just want you to know the names and know more or less how they work. Now, just to finalize, I'm going to show you how this is found in the paper. So again, I'm going to use the Chowdhury paper and then the one that we did. And you can see that in our summary, we have that the authors use the Markov model. This is, again, sorry, just to tell you this Parkinson model. So the authors use the Markov model to estimate the incremental cost-effectiveness ratio, which involved determining the average cost life years and quality-adjusted life years per patient for both comparators. And you can see that we found that in the model structure. of the section of the model structure of the original paper, which said Markov model was developed using NHS England and personal and social services perspective. So you even have the perspective in here to determine the average cost life years and quality adjusted life years per patient associated with Parkinson's disease, and thereby calculate the incremental cost effectiveness ratio. Okay. Then in terms of characterizing the Markov model, we did our summary saying that the Markov model classified patients into 25 health states based on the Owen and Yar stage, so the HY stage, which could go from 1 to 5, with higher stage implying more severity, and the amount of off time experienced, measuring in increasingly deteriorating levels from 0 to 4, assuming a 16-hour walking day as well as death state. And you can see in the original state that they say the population into 25 combinations of disease-specific health states, comprising stages of 1 to 5 of the HY, and the off time, okay, exactly the same. So you just need to go into the methodological section, and in principle, it should be very clear what they did in that part of the paper. So yeah, sorry, I forgot this part. So first was the type of economic evaluation, and then the health states. But again, you should be able to find this in the methodological part section. So now, Valerio, should you go in?
Yeah, no, thanks, Luis. You can stay with the slides. I mean, we only got a few slides, so you can probably.
Okay.
I can tell you when to move to the next one. That's fine. Thank you, Luis. So now you're going to hate me. We're going to talk about homework. So you got one task now, which is to fill in a table with info on the key attributes for economic evaluations. So today we went through quite a few concepts regarding the economic evaluations, and what we're going to ask you to do is look at your paper. So you got a PDF on Teams. If not already today, tomorrow will be there. Look at your paper and try to find different information about the economic evaluation within the paper. And I'm going to show you the table in a second. So you can find the homework document on the session 2 folder. So if you open that folder, you will see a document with your name on it. So you got a specific document with your name on it. You can open that document and you see this table. The table's got 4 columns. You got information about the attribute first, so the population, type of intervention, location, settings, the definition, and where you can find the info within the paper. Okay, that's typically where you should be able to find this information. Okay, there might be some exceptions, like the authors didn't describe the, I don't know, the location properly, or the type of economic evaluation properly, and so on. So there might be some exceptions, and we could possibly point these limitations out in our commentary. But if you're able to find the information, just simply copy and paste the information in the last column, okay? And you got all the different concepts we covered today in that table. Any problems? If you struggle to find information, it might just be that the paper is not very well written, okay, for that particular concept. So if you struggle, do get in contact with your team lead, okay? So we are there to help you. And if you complete the homework and you want some feedback, do get in contact with your team leads, and we'll be more than happy to have a look at the homework and give you some feedback, okay? Next slide, thank you. And this is just a recap of where we are in terms of the progress of the course. We've done a session 2 today. We will see each other again in a couple of weeks on Monday, the 15th of June. There will be a session on cost run by Luis and Ryan. And just a little note, just if you haven't done so already, please respond to the invite for the workshop, because we are finalizing the numbers now, so we need to book the catering. And if you don't accept the invite, you might not have any sandwich to eat. So just let us know, and we can finalize the catering order, okay? I think that's it. So the last slide is just with our email address for Luis and I. But if you got any questions, particularly regarding the homework, just let your team lead know. And thank you again for attending today's session. And we'll see you in a couple of weeks' time. Thank you.
Thank you.
Thank you.
Thank you. Bye now.
Thank you all. Bye.